gross habit can trigger brain inflammation that leads to Alzheimer's, scientists warn. Though it's frowned upon in public, most of us will sometimes stick a finger up our nostril when we think nobody's looking. However, this gross but seemingly harmless habit might have some unforeseen health consequences, with researchers claiming nose-picking could increase your risk of Alzheimer's disease. The theory behind it is that digging into your nose could allow bacteria, viruses, and fungi to enter the brain, where it can cause inflammation. As we age, this then damages brain cells and results in the symptoms we all associate with dementia. There is a growing body of evidence linking the habit and unwanted outcome, and experts want even more research into the potential association. Scientists who published a letter in the American Journal of the Medical Sciences last month urged more research to validate these results because the available data is significant but scarce. Missing woman with Alzheimer's is found by police standing in swamp at 2 a.m. Citing 10 research, they said, several pathogens, including those that invade the brain via the nasal epithelium, have been linked to Alzheimer's disease and have been isolated during post-mortem analysis. We propose more investigation to understand the association of nose-picking with Alzheimer's disease in the form of case control studies with larger sample populations. These studies conclude that nose-picking is a significant risk factor and contributes to the progression of Alzheimer's disease. The brain-robbing disease causing memory loss and cognitive decline is a complex neurodegenerative disorder that can be triggered by many possible factors, according to an Australian study team whose work was published in Biomolecules. Most read in Health, however, the accumulation of tau and amyloid in the brain, which results in plaques and tangles and impairs brain function, is one of the main characteristics of Alzheimer's disease. More recent evidence suggests that neuroinflammation may also play an at least partial role in the development of the disease, the experts added. I saw my mother pass away from an illness that destroyed her brain, and a few months later, I also got it. This is the term for an inflammatory reaction that an infection or damage can cause in the brain. Emerging research has explored the possible involvement of external, invading pathogens in starting or accelerating the neuroinflammatory processes in Alzheimer's disease, they noted. The olfactory system, which includes the nasal cavity and nerve cells related to our sense of smell, is a plausible route for infections to enter the brain, according to their analysis of thousands of studies. It is said that pathogens such as herpes, COVID-19 viruses, or bacteria that cause bronchitis or pneumonia could be connected to neuroinflammation. After considering the review's findings, scientists proposed that washing your hands more frequently could help you avoid contracting the illness. Among all the entry routes, the improvement of hand hygiene might be an easy prevention step, as learned from the COVID-19 epidemic, they stated. One of the lessons learned from COVID-19 is the value of hand hygiene through frequent hand washing and the use of hand sanitizers, and we suggest these routine hygienic procedures be mandatory routine procedures for the incurable nose picker. The researchers from Western Sydney University did, however, wonder if nose picking was the root cause of Alzheimer's or if the disease that steals brains prompted individuals to develop bad behaviors that inflamed the brain. One of the limitations of the infection hypothesis of Alzheimer's disease is the debate of what comes first, the chicken, Alzheimer's, or the egg infection, the experts added. Could it be that individuals with weakened immune systems are more susceptible to infections that induce neuroinflammation and Alzheimer's disease? Or does increasing inflammation due to aging and subclinical Alzheimer's disease cause immune defects or unhealthy habits, allowing the entry of olfactory pathogens? In any case, their research adds to the body of research that indicates a connection between the two. A rodent-based study from Griffith University discovered a weak correlation between the undesirable behavior and the accumulation of proteins linked to the disease that steals brain cells. The researchers used Chlamydia pneumoniae, a rare kind of bacteria that may cause pneumonia and other respiratory tract illnesses, in their experiments and discovered evidence that the bacteria can damage the tissues that line your nose, allowing harmful germs to more easily enter your brain. In the UK, there are 900,000 persons who have dementia at the moment. It is the leading murderer in the UK. Expert: Amy Sladen may have swapped addictions following weight loss surgery. There is still no cure for the growing number of cases. Existing treatments just manage symptoms. Along with vascular dementia, Alzheimer's disease accounts for the majority of occurrences of dementia. What are the signs and symptoms of Alzheimer's? The primary cause of dementia, affecting almost 600,000 individuals in the UK, is Alzheimer's disease. The accumulation of harmful proteins in the brain, often referred to as tau or amyloid, is what causes Alzheimer's disease. These damaged clumps obstruct and destroy essential nerve cells. Patients who suffer from damage to their brain's nerves lose the ability to regulate their muscles, think clearly, and feel emotions. Although the exact etiology of Alzheimer's disease is unknown, the following factors may make you more susceptible. The largest risk factor is age. 95% of cases start after retirement age, and beyond the age of 65, your chance of getting Alzheimer's doubles every 5 years. Additional dangers consist of Alzheimer's disease in the family history, consuming tobacco, overindulging in alcohol consumption, being overweight, insufficient exercise, loss of hearing, head trauma, syndrome downward, heart conditions. Depression. When Alzheimer's symptoms worsen, it's frequently too late to receive therapy because the disease often progresses slowly over several years. Symptoms in the early to middle stages include short-term memory issues, having trouble remembering the correct terms or names, anxiety or dread of change or new things growing, depressive or erratic moods, perplexity getting lost while traveling, having trouble falling asleep. Alzheimer's disease cannot be cured, although medications can lessen its symptoms. In 2024, drug authorities will make a decision regarding the approval of a novel class of medications that purport to remove harmful proteins from the brain at the very early phases of Alzheimer's disease. Thanks for watching this video. Please subscribe to our YouTube channel, America Trends 24, and stay with us.